Now, all new at 11, and many doctors' offices and med spas offer seemingly small nips and tucks to make patients look and feel younger.
Some of those doctors may not be qualified to handle those procedures, but the law says otherwise. Brittany Miller exposes the loophole that is endangering people's lives tonight. Brittany?
You know, in a culture where many people trust doctors, you wouldn't expect your general practitioner to give you a facelift. Why? Well, because it isn't their area of expertise. But tonight we discovered in Georgia, physicians can do whatever they want and get paid on the spot. We do want to warn you, this story contains some very disturbing images. Year after year, you've watched news reports of countless patients being butchered, botched, and burned. Many of them living with the scars of a surgery gone wrong.
Yeah, this is Dr. Angaraj. We have a patient that's status post breast dog, and she had a large hematoma. Okay.
This happened in 2010. The man on the phone is an eye doctor. His patient was bleeding out as he performed surgery. The procedure, a boob job. In 2014, 2 women died during an operation with Dr. Nedra Dodds. The ER physician was performing plastic surgery. Then there's Dr. Wendell Boutte. In 2018, you knew her as the dancing doctor.
All day long.
As far as I know, that was just her dermatologist.
O.J. Liburd says his mother, Isilma Cornelius, saw the skin doctor for abdominal surgery just before her wedding. But under anesthesia for too long, she crashed. Dr. Boutte couldn't help her. With no hospital privileges, all she could do was dial 911.
That first day of seeing her in the ER, her face was bloated and her tongue was sticking out a bit.
Cornelius suffered a traumatic brain injury and now needs 24-hour care.
There's nothing criminal about what they're doing.
In Georgia, it's all perfectly legal.
As long as you have an MD behind your name, then you can do whatever you want.
Susan Witt, Cornelius' attorney, says state law allows dentists, dermatologists, or any other physician to pick up a scalpel and cut people open. No special training required.
We see doctors who are taking like weekend classes and then coming out of those weekend classes and all of a sudden performing liposuction.
And they're doing it for the dollar only.
Board-certified plastic surgeon Dr. Keith Jeffords says for many doctors, it's become a side hustle, working in medi-spas or private offices, which allow them to bypass the credentials usually required in hospitals.
They feel like that's a way to cash out from insurance to go into some form of cash-only practice.
So we asked State Senator Jen Jordan if anybody cares to operate on this broken system.
And so right now we have a regulatory framework that requires physicians who are using anesthesia to have certain training and certain licensure.
Forcing them to learn how anesthesia is managed and how to handle complications.
At least that's a start to make sure that some of the basics are in place and make sure that patients aren't dying. But we also have to make sure that the board can enforce those regulations.
The Georgia Medical Composite Board is a group of physicians who are supposed to act as watchdogs.
And then the board really doesn't get involved until there's been a death or even multiple deaths. And that's really because of a resource issue.
On top of that, she says the board doesn't double-check a physician's background or training. So until a law is passed, what should patients do?
You must interview them. Do not be afraid to ask questions.
Questions O.J. Liburd wishes his mother would have asked before going under the knife.
I don't want anybody to have the life that my mom is having.
And just to go over some of those questions you should ask a physician where the surgery is going to be performed, or do you have hospital privileges? We'll put more information about this on our website, including laws in other states and what it really means when a doctor says they're board certified. We learned that can be a flat out lie. Brittany Miller, CBS 46 News.